All right. That sounds good.
All right, good afternoon, everybody. Welcome to today's seminar presentation. I want to take just a moment to invite you all to next week's seminar presentation, which will feature Shannon Terrio, the Director of Environmental Health, and Gina Miller, the Environmental Health Manager for Missoula Public Health. They're going to be presenting next week on the public health response to urban camping, regulatory complexities. So a very interesting presentation to look forward to next week. And we get to dive into a very interesting presentation right now. So it's my pleasure to introduce B-Rad Applegate. He is one of our public health nurses, infectious disease nurse at the health department. And he is going to be presenting today on From the Other Direction, Extending Newman's Nursing Theory of Health is Expanding Consciousness to Inform Public and Community Health. And so for all of you who are research minded and those of you who are theory minded, we all get to come together today and meet that crossroads. So thank you for being here today and welcome, B-Rad.
Thanks, Damien. So positionality statement. I am a white, non-Hispanic, cisgender male, disease intervention specialist at Missoula Public Health. And I'm also a doctoral student here at the university. I do have a Bachelor of Arts in Philosophy from UM, and you're probably going to see a lot of that come through in this presentation. And a fun fact, I have degrees from both MSU and University of Montana. But don't worry, I'm all grizz when it comes down to that decision. And I'm originally from the Cleveland, Ohio area. Disclaimer. So right off the bat, I'm a nurse. That's my background. It's what I know. This presentation is a nursing theory that I think really applies to a lot of what we do in public and community health. I'm going to talk as a nurse, like with that, that's part of who I am. One thing that we're going to get into is these unitary theories, the idea that we are a human is an individual, like total unit, and you can't really separate parts. But I want to take a moment to acknowledge that there are lots of other awesome degrees that people have that work in the field, and I'm not trying to come across as elitist. Nothing that I'm going to talk about requires a nursing license. I'm not doing any nursing specific skills, so you'll all hopefully take something away. Some of those things I hope you can take away are that there's a need, maybe more room to talk about theory in public and community health. And nursing has been an important part of the field for a long time. You should know what a nursing theory is by the end of this. And epistemology is one of my favorite vocabulary words. So we're going to talk about that. And then specifically with Newman's theory, a general overview, how it can be used with individuals and also in a research context. Because in public health and community health, we definitely work with individuals and we work with populations. So right off the bat, I found this article, and you can see it's dated 2019. And what these authors are doing is saying that in public health, we need to have a unified theory. And they're talking about a research theory, but I think this can also extend to practice. That there really isn't like, if I were to say, what is the public health theory? There's not really like one consistent theory, but actually it's a multidisciplinary field. So I'm looking at my professors when I'm a student and looking at their backgrounds. I see PhDs in a lot of different fields, chemistry, anthropology, social work, just to name a few. So a multidisciplinary approach is when these different fields are combined in a way that they're just brought together for the discussion. And then we get to an interdisciplinary level, and that's where they're integrated. And we're probably at least at an interdisciplinary level where things are becoming more integrated from different theoretical backgrounds. But the call here is to eventually work toward a transdisciplinary theory. And that's where we're not only integrating, but we're also creating new conceptual frameworks. So in a paradigm, this is kind of how we think about the world. And you can see it's kind of like Maslow's pyramid, but it's upside down. So you have ontology, and those are theories of being. And those are informed at the next level down by epistemology. Remember, I said that's one of my favorite words. And that's questions about knowledge. How do we know? How do we know? What's the theory of knowledge? Methodology, those are overall processes that we use to research. And then when we have a specific question and we're really drilling down for specific information, usually researchers design studies with specific methods. I think it goes right back up the pyramid too, that the methods give us information to inform future methodologies, that tell us something about knowledge that we can incorporate into the way that we are. So epistemological perspectives. So this, Jim Karinji gets credit for this. He told me once upon a time, think both and. I love that. We're not trying to say that one way of knowing is better than the other. So right away, this is a perspectivistic approach. And I think the more perspectives that we can incorporate into our knowledge, the more dynamic we're going to be in our approaches to our lives and our work. So everyone's heard of evidence-based practice, and that's great. Evidence-based practice is wonderful, but it's not the be-all and end-all, even though it gets a lot of respect, well-deserved respect. Sometimes I think people jump right to this empirical and positivist approach without having room for other ways of knowing. So there's evidence-based practice, but what about outcome-based? Laura Marks gets credit for this. She was a nursing professor, and the example she used is you're doing something with a patient, and it might not be something that's evidence-based and researched already, but you can tell it's working and you can tell it's effective and something good is happening, a desirable outcome. So you can continue to do that. Newman talks about theory-based practice. So this whole nursing theory informs the way that we do things, and that's different than the way evidence would inform something. So we're practicing at a theoretical level. And I just want to ask people in the room if there's any other epistemological perspectives, ways of knowing. You don't have to shout at once.
Individualized?
Sure, individualized.
Experience.
Yeah, you can definitely lean into your experience and lessons learned, the school of hard knocks. Thank you. So, maybe one way to help think about this is not everything we do all day long is informed by evidence. We might do evidence-based interventions, but are you answering your phone in an evidence-based way? Are you dressing in a way that's evidence-based? So I want to give a nod. I'm talking about a specific nursing theory, but in the world of public and community health, there are a lot of health behavior theories. This is a short and not all-inclusive list. I'll just let you look at it, point to a few of my favorites: the health belief model, trans theoretical model. That's kind of a collection of different theories. And then I also really like social capital, the idea that, we have people in our lives and events that we go to, places where we might go to exercise, and we have communities of other people, and those networks of involving social experiences are like an investment, like capital, like money, but you don't get to spend it, you get to enjoy it. So nursing, just for example, Missoula Public Health. So it used to be Missoula City County Health Department, rebranded as Missoula Public Health. 103 employees. Of those 103, 17 are union nurses, and there's 5 more nurses in management. So that's a total of 23 nurses out of 103 total employees. I'm not doing a lot of math right now, but that seems like a little over 20%. So there definitely is some representation from the nursing profession in the field. Brant might be joining us online. Brant is someone who used to do the job that I did a long time ago, is a nurse, now works at the CDC level. And I've had the opportunity just to hang out and have some conversations and learn some practice wisdom. Another epistemology, learn practice wisdom from people that have been in the field a while. And he told me a story that I'd like to share real quick. And that is, Ellen Leahy, our former health officer, sent him to Johns Hopkins School of Social Work. Public Health, School of Public Health. And he got his master's in public health. And during that, he took a class called Public Health Problem Solving. And someone asked the professor, where does this information come from? Where do these theories come from? And this was early on in the development of the academic field of public health. And the response was, these are mostly nursing theories that we're just revamping for public health. And then I don't have a specific article, but there is a journal of public health nursing that's been around for almost 40 years. So I think that this establishes a strong connection between nursing and public and community health. So Newman, this is who we're really here to talk about today. Margaret Newman. She was an amazing person. She went to get her first degree in home economics, I believe. And after her undergrad, came back and her mom was sick with Lou Gehrig's disease. This is a disease where you voluntarily motor neurons that make your muscles move, you lose control of those. So things like being able to stand here and move like I want to. I mean, think about eating and swallowing. After 5 years, her mom eventually passed away. And during that process, she realized that this idea of health is the absence of disease and disability is just an archaic definition. That through that dying process, there were still moments where they experienced wholeness and they experienced meaning and purpose. And that, would be constituted as health. This health is expanding consciousness. That's the theory that we're starting to dive into. So based on that experience, she decided that she needed to go and become a nurse. And when she became a nurse, she was working through her graduate studies and studied under a nursing theorist called Martha Rogers. And we can talk more about that in a moment. Here are some basic assumptions of health as expanding consciousness. So health is an evolving and it's unitary. That's where Martha Rogers' theory, she was the theory of the humans as a unitary being. That we are, like Descartes said, that you have mind, which is non-extended thinking substance, and then you have body, and body is extended non-thinking substance. So how can these two even interact with each other? They're totally different. That's a dualistic approach. And Martha Rogers came along and said that is absolutely not the way that the humans are wired, that we are a whole, and you can't divide that whole into separate parts, and the whole is greater than the sum of those parts. And in this pattern of health, this unitary pattern, there's an evolving pattern of disease. And a lot of times, disease is present before it manifests itself in the form of disease, like it's there. And we can think about this in the term like genetic disorders. So you have the genes that are present in your DNA, and you can have something that is going to become activated as life goes on. And there's also maybe lifestyle and behaviors that people are doing. And this is where we might have more influence in our work with public and community health. And I'd like to give a nod to a coach in here. And I think it goes both ways. I think that maybe these patterns of physical fitness might be present in the individual through, showing up and putting in the work before they manifest physically in the body. So I think it goes both ways. Consciousness. What is consciousness? That's a question. Well, it's informational capacity of the whole, and it's revealed in an evolving pattern. And then this pattern involves the human, the environment, and it's characterized by meaning. So a lot of times when nurses are working with people, we find them because they're sick. That's when we encounter them. There's something going on, and they're in the hospital, or they're on my list to call for a follow-up on an infectious disease. And that's where we're meeting them. And that's what we're doing the work as a nurse. And when I talk about this in the context of public and community health, I think that maybe we can shift upstream with some of these processes. So I want to put that in your head right now when I'm talking about the theory. And then every person, I love this quote, is in a process of becoming more oneself, finding greater meaning in life, and of reaching new heights of connectedness with other people and the world. So here's some supporting theory. I talked about Martha Rogers, the individual as a whole, the unitary theory, Baum's theory of implicit order, and that's where the idea that the disease is a manifestation of the pattern. It's not separate. I'm not going to try to pronounce this name, but the theory that negative events are also part of expanding consciousness. We learn a lot when we suffer. And then Arthur Young's theory is the evolution of consciousness, that individual, we have this freedom and we think we're free. And then all of a sudden you get an ankle injury. So now you can't run and you can't ride your bike, you can't skateboard. So you experience that as a loss of that freedom. But what this theory, that's when the nurse is going to work with the individual to help them come to a new meaning of understanding what it is to be in the world in the context of that injury, evolve to a higher form of consciousness, and through that find new freedoms. So you lose the freedom, but then you get a new freedom back. So this is getting a little cerebral, but we're talking about how do we know about consciousness? Because consciousness is something that's pretty intangible. And this is epistemology. So Harman came out with this, and this really influenced Newman's theory and her understanding of what consciousness means. So when we try to learn and study consciousness, it's experience, right? And our subjective experience is the primary data. It's going to aim at being objective, but that's impossible because we're not sitting here like, oh, there is consciousness in a box and I'm standing here outside looking into it. I'm a conscious being using my consciousness to understand consciousness. So I'm in the box, but that can't be separate from the experiment. So there's just got to be room for having some perspective there. It's going to insist on open inquiry and public validation, but people might disagree on this in the public setting. So there's going to be some different perspectives on it. It's going to insist on a unity of experience, meanings of experiences understood by discovering interconnections with other meaningful experiences. Meaningful experiences and other meaningful experiences tying together. And it's participatory, and there's a partnership between the researcher and participant, exploring together and having shared understandings. And because of that, the researcher needs to recognize that as they're learning about consciousness, that's going to create a personal change. And you have to be open. I mean, I think that's, if you're going to inquire anything, you might as well have an open mind and be willing to change as you learn. That's the process of growing and learning. And then there's room in this theory that maybe at some point a different epistemology is going to come along. People are going to learn more about consciousness, and it's okay. We can totally replace this. And something better comes along. So what's nursing praxis? This is a combination of just having an intertwined research and practice approach. And this is grounded in a unitary and transformative paradigm. So that transformative, there's different types of research that we can do. We can do research that's aimed at just gaining knowledge and learning something. And that's great. Knowledge is a beautiful thing to have. Knowledge is power, right? And then there's also research that through the process of engaging in the research, that it's expected that the research participants are going to have some kind of a change. So an example of this is photo voice. That's a research method where it's a methodology where people take pictures. You're instructed to go take X number of pictures, write a little caption at the bottom of each picture about something like what's keeping you from going back to experiencing homelessness in Spokane, Washington. And you might write about that, reflect on it, and then come to a focus group type setting where you would share show and tell with the photos and captions. And through that process, you're going to be reflecting on your position. You're going to be reflecting on your behaviors. And right there, that's going to be the catalyst for some change. And this health is expanding consciousness is definitely falling into that transformative spectrum. And there's a dynamic partnership between the nurse and the client. There's a dialogue of evolving pattern of meaning, insight, and action. So meaning, something that's evolving, leads to more insight, which we put into action, hopefully. And then just like the epistemology before with consciousness, this nursing theory is transformative for both the nurse and the client. And I have an example at the end where I'm going to talk about how an agency expanded their consciousness and through that had a change for the better. And then this is a shift from the positivist, rational, logical, objective, to something more intuitive, a unitary approach. I think emotional intelligence. Newman put a lot of value in just our gut instincts and our intuition. Not everything is something that we can understand with a rational mind. So here's kind of a textbook example of this research as praxis when you're working with an individual. And that's where you have rapport is built, you have a meeting, and what is meaningful, that's the question. So Newman was working early on in her academic career and wanted to validate and kind of prove this theory. So she was using it in research applications. And she had some semi-structured interview questions, and her graduate assistants were asking these questions to research participants. And one of her graduate students said, you know, I really wish I could just ask what events and people are meaningful in your life. And Newman said, yeah, go ahead, let's do that. And that kind of turned to be the golden question in the theory, that you ask people what events and individuals are meaningful in your life. And then the client will talk about that, and the nurse will, take notes and be present and facilitate the conversation. And then they go away, and the nurse has some homework, and you take some paper and you draw a diagram, and you kind of diagram out that person's life story. And they're going along life in a squiggly line. That's the pattern. And then they'll talk about something meaningful, an event or a person they met. You don't have to be like, Picasso or anything, just a stick figure will do, but you try to draw that out, have some kind of visual picture representation of that. And then the pattern changes. So the squiggly line might be higher up on the paper, and it might have a different squiggle pattern. And then there's another event or person, etc. And you take that to a follow-up meeting and you show that to the person and say, well, this is kind of what I got from your story. Can you explain, is this accurate? It's like member checking in research. You go back and say, hey, do I actually accurately understand what I'm trying to understand? And the person then gives feedback. So research methodology, we're getting into research now. That was individual level. And, just because that's the way that this is diagrammed, it doesn't always look like this. For example, a lot of the work that I do as a nurse is talking to people on the phone. And usually it's just a one-shot phone conversation. And when I'm talking to someone that's more open to having a conversation and doing some health educating, then, we can talk about what's meaningful and talk about how, well, whatever a new diagnosis of HIV, for example, it's a chronic infection. It's not going to go away. So that's, a great opportunity for someone to shift and maybe rearrange their pattern and just inspire that reflection into meaning. And there might be a follow-up conversation, there might not, but I'm not doing the squiggly line on the paper, and I'm not sitting down with them to member check that. So even though this is textbook, it doesn't always, there's a lot of room. One of the things that I love that Newman wrote is this theory is in the early stages of development. So there's a ton of room for growth. And what I'm proposing today is some of that growth can be pulling it into public and community health. So nursing praxis is something I already talked about. There we go. You got to push the right button on the clicker. So this is where we're talking about using it as a research methodology. So I have a couple studies, 3 articles I want to discuss. And the first 2 are studies, and the third one is, we'll talk about it when we get there. This is when we looked at immigrant women that lived in Korea, and they were just trying to learn about them. So it's a qualitative study, and it's based on ethnography. And that's where the researcher observes how members of a community build their own world, how they cope and interact with their real life environment. So that's what kind of an ethnography is. And the health is expanding consciousness is used in the data analysis. So there's a structural analysis, and I think they used Bradley in this one. But then the interpretive framework, once you have that data and you're looking at it and you're trying to interpret it and make sense out of it, that's where this health is expanding consciousness was used. So specifically, I want to point your attention to the red, but this is a quote from the article. Right on. Participants gained insight by seeing the world from a new perspective and moved into an expanded area as they interacted with the environment. So this trajectory is confirmed by Newman's theory of health, which recognizes health as a process of expanding consciousness over time and space. Therefore, Healthcare providers need to design specific programs to help married immigrant women expand their consciousness in a way that reduces chaos and avoidance experiences and enhances intuitive and complementary experience during the acculturation process. So what's that saying? That people in the study expanded their consciousness and got new perspective, increased self-awareness. That's consistent with Newman's theory. And, that's what we need to have more of. More programs to expand consciousness. Nursing students. So there was a pandemic in 2020, and a lot of things shifted. So we had this virus and we were, coughing it on each other and people were getting sick. So one way to prevent the spread of the virus is to go remote and have people sit in individual rooms on computers instead of all being in a room like you are today. Unfortunately, no one's coughing on anyone in here right now. But anyhow, so when this shift happened, it was pretty abrupt. A lot of things were changing in the world. I think all of us remember that all too vividly. So this study was a descriptive qualitative study with a content analysis approach using individual semi-structured interviews to explore the mind of Chinese nursing students transition from classroom to online learning during the pandemic. And one thing I want to say about Newman's theory is because we think of Western thought in a real linear way. It's like you start with point A, you go to point B to point C. It's logical and linear. Eastern thought is more circular. And an advantage of a circular thought process is if you can position yourself in the center of that circle, then you're kind of equidistant from all the different knowledge. So it's maybe some people think of it more of an efficient way. That's not really what I'm here to talk about, but the significance of that in today's context is that this expanding consciousness theory resonates more in Eastern cultures. So it's been used there more than in the Western world, from what I've read. And just like the last article, health is expanding consciousness was used in the interpreting and making sense out of the research. So what did they learn? Well, the participants gained insight by seeing the world from a new perspective and moved to an expanded area as they interacted with the environment. And this is confirmed by Newman's theory of health as expanding consciousness. Didn't I just read that? So you really got to pay attention to which way you're pushing these buttons. Okay. So this is where health as expanding consciousness gave us good opportunity to understand the involvement of nursing students in pattern recognition and psychological transformation. So it started where they would accumulate information. That led to an expanded consciousness, which led to self-empowerment. They learned how to better regulate their emotion, which led to more psychological resilience. This is a slide that we're not going to spend too much time. This is cut out of that article, but you can see on the left, you have a couple different gray boxes, and those are just areas that they were assessing: emotional impact, self-efficacy, time management, and coping strategies. And then going from left to right, there's a progression over time. And you can see, I think, emotional impact. Everyone probably can relate to that. We've had anxiety and we were depressed, we were stressed out. And then as we started to adapt, it got a little more firm, a little more resilience. And then maybe even at a certain point that led to an optimism. Okay, this is the new world and we're going to embrace it and have a, go to the bottom there, bottom right, an expansion of consciousness. So I like that coping strategies too, going from overwhelmed, and then we're powering through. And there we are, expanded consciousness. Grounded theory research. So this is the third article I was talking about. So this is not a specific study. There was no research. The article is talking about how health is expanding consciousness could be a great perspective to use in conjunction with grounded theory. And grounded theory is research that's useful for uncovering patterns. So right there, patterns with health as expanding consciousness, looking for patterns in grounded theory research. And then you look at those patterns that you find in the data, and that's where the theories are constructed from. So underlying assumptions of grounded theory are that people have shared meanings. So think about that. We have similar people and similar demographics, people in various cultures, maybe in indigenous cultures, or maybe people that are sharing a common life experience, like going through an academic program at the university, but shared meanings and experiences, and that all concepts pertaining to a phenomenon have not been identified and are conceptually undeveloped, and relationships between concepts are poorly understood. So this is not only the shared meaning, but it's something that might not be well understood, which creates an opportunity to probe deeper and learn more. No research, this might get, I totally am going to stand behind this quote. No research is atheoretical. Going back to that first article from 2019, one of the points is that they're calling for, when you're writing an article, I'm talking to some people in here that might be publishing articles, and when you're publishing your article, submitting for review, in that article, you should write what your at least a little bit of what your theoretical orientation is. And of course, the authors acknowledge, well, you know, we're limited by word counts and how much we can put in there. And but the authors also then said, well, some of the better journals, and I don't know what journals they were talking about. I don't want anyone to hunt me down after this, but some of the better journals go so far as to require a statement on theoretical, a section on theory. So I'm going to say that no research is atheoretical. And this comes from this article. My theoretical perspective of health as expanding consciousness plays a role in decisions that I make regarding what I study, what data I collect, how I define my key concepts, and how I address assumptions in research. And back to that, similar patterns, similar life experiences. So this is kind of where the road meets the rubber. There might be some people in here thinking, this is great, B-Rad, but what am I going to do? So here's what we can do. Here's what we can do in public and community health. This theory enables change. Expanding consciousness, evolving to a higher pattern, enables behavior change. So we can engage in self-reflection and have a deeper situational understanding. And that's when we're working with the populations that we work with. But we, as public and community health workers and researchers, are also expanding our consciousness, and we're also changing and evolving as beings. That's not something we're immune to. So we're going to grow with the people that we serve. And looking for meaning, always pausing in the work. What does this mean? What's the significance of what I'm doing? What's the significance of this event? What does it mean from someone else's perspective, especially someone maybe who's has a different cultural background? Things might have different meanings, and to really take the time to try as hard as you can to put yourself in that position and understand different perspectives, understand different people. And as you saw, there were a couple articles where this was used for interpreting research data, and that's something we can totally do, is use this theory when we're trying to make sense out of data as we're researching. So one thing I said early on that I want to come back to is thinking upstream. So earlier I mentioned that the nurse is someone that meets someone when they're maybe not doing well. And then the example was maybe a newly diagnosed case of HIV. How can I shift this into public health prevention work? A lot of the work that I do with infectious diseases really starts with prevention. And if I can prevent people from getting infected, then that's more, in a lot of ways, that's better than, waiting until someone's infected and then trying to do the best that we can, which is still, there's like with HIV, I just want to say there's great medications. It's not the 80s anymore. And the language now is people living with HIV. It's a chronic infection, but people can thrive with it. But still, if you don't have to take pills, if you don't have to rely on frequent blood draws and doctor's appointments, and you can avoid getting that infection, I would imagine that would lead to, maybe a slightly better quality of life. So how can we take this process and move it upstream? That's kind of a big question that I'm trying to mull around and hopefully incorporate into my work as a student as I continue to go forward through the program toward a dissertation, but thinking in terms about how can this be used to create an opportunity, what Newman calls a choice point, to reflect and create that change in behavior. So I think that that's something we can do with a lot of the programs and a lot of the work we do in public health. Think upstream about how we can have people expand their consciousness and alter their pattern. Like we said earlier, I said the disease is present. I think that maybe the fitness is also present in the pattern before it manifests in the individual. So how can we shift that pattern in a way that's going to point toward a more meaningful, higher quality of life for the individuals we're working with? Our theoretical persuasion is what we see. If we're looking for pathology, that's what we see. If we're looking for pattern, that's what we see. So just nod to Ellen Leahy, our former health officer. There was a pertussis outbreak in the public schools in Missoula, and she was sending all her nurses to go and do screening. And I remember her famous words before we went out to go ask students about their coughs was, when you go looking for trouble, you're going to find it. And this is great. This is a theory that this inspired me when I was a nurse. This has a lot of things that inspired me when I was a student of philosophy. I love this theory, and it might not resonate with you, and that's okay. So maybe this isn't the way that you're going to approach your work, but back to no research, no work is atheoretical. I encourage you to find a theory that resonates with you and makes sense to you and incorporate that, and just have that theoretical orientation and add that theory informed practice to your bag of epistemologies. So data collection, this is something we do a lot of in our research, and people are going out and collecting all kinds of data. So in the context of health is expanding consciousness, it's important to be super intentional about why we're collecting the data and what data we are collecting. It's not good enough. Like when you're asking someone a question, a lot of the data we collect is intimate. You're asking about people's like height, or maybe their weight, or maybe like what kind of sex partners they have, or asking people, you know, what they identify as far as gender identity. We're asking people all kinds of personal information. And just because we're researchers and just because we're doing research doesn't justify us to go and have all that private information just come into our, you know, our world. And then also, how are we going to analyze the data, and thinking about that at the time that we're collecting it. And I think in some research, maybe Damien's familiar, the outliers, maybe sometimes we're looking for outliers in the data because that might be more significant and tell us a more important part of the picture than just the patterns of where the common data goes. So what are we looking for? And then what data are we going to find significant? And for those of you who might remember, Dr. Albert Borgman was a professor here at the university. And he told me once in class that an example is worth 1,000 definitions. So here's the example. So when I was a student nurse, I was like going through these different layers of, I'm not sure what example I want to use, but it was a lot of suffering, a lot of hard work. And I was at a point where I didn't have a lot of will left. I just wanted to graduate, get my degree, and get my license. So I'm going through this process, and someone tells me I have to go to the health department and we're going to go take BMIs on school children. So that's what I did. I showed up with a scale and a stick, stand on the scale, stand next to the stick. We can't say your number out loud. And we took these BMIs. And then started to reflect on that now that I'm no longer a student. And we learned that can be harmful. That can lead, you know, people might be overweight or underweight. They can get a lot of anxiety just before they have to step on the scale. There's a lot of new wisdom now in like health and nutrition culture to throw away the scale. Like, don't get on the scale. That's not a number that is super informative. We know that BMI is not a great indicator of physical fitness. So why are we doing this? To compare ourselves to Bozeman? Well, after having those conversations internally, Missoula Public Health has expanded their consciousness, and now we no longer collect that data. There's some references. I want to just add one thing. I know that I'm getting near the time when I'm supposed to let you ask questions, but this nursing theory is not something that is really taught a lot in nursing programs. It's something that I think MSU, in one of the earlier classes, you have to read a section in a book about different theories, find one that resonates with you, and write like a paragraph on an online forum and post to someone else's. And, this is the theory that I found way back when. But that's not something that shows up on the NCLEX exam. And a bachelor's degree in nursing is one of the ultimate false summits. So a false summit is when you're hiking up a mountain and you see the top, or what looks like the top, and then you get there and you're like, the top's way up there. So you get this degree, you work really hard for it. You have to show up at 6 a.m. in scrubs and do all kinds of things. And then you can't do anything with it really until you pass your NCLEX exam and get your license. So of course the program wants to prepare the students to pass the NCLEX, and nursing theory is just something that doesn't really show up on that exam. So this is something that might be more incorporated in more graduate level studies. But I think it is super important for all nurses to be familiar with the theory behind the work that they're doing. So this is where some references show up. I want to give a special thanks to Cindy, my supervisor, Cindy Farr, Damian, my supervisor, and my advisor, Jim. Those people helped me brainstorm. They gave me the opportunity to be here, and really appreciate a lot of people, but those are the 3 I want to name. Okay, questions.
Questions for B. Red? I saw the novel.
I'll ask a question. How do you, the 2 articles that you mentioned, 3 articles you mentioned, in terms of Eastern culture, how do you know? I guess what I was thinking was, is it the Eastern culture that's imposing how they want the individuals to be? In terms of the immigrant women coming in, are they wanting them to conform to what the culture is there, as opposed to accepting the differences that are coming from outside?
I think it's a blend. I think it's that, yeah, they come from different backgrounds. One example used was that one of the Korean husbands gave his wife some money, and she saw him jot that down, the amount. And she's like, why did you jot that down? And he's like, oh, my mom told me if I give you money, I should just write it down. I don't know. And she got pretty upset by that and said, well, I don't need your money if you're just gonna, count it like that, like you don't trust me or whatever. So, that could be a difference in maybe how he was brought up by his mom versus where this wife had a different cultural background. And I think that it's not an either or, it's a both and situation, both helping to get her to understand the culture, but also helping the culture and the husband to maybe everyone can expand their consciousness.
2 follow-ups. One is that I would say, I would ask or posit that could the study findings have been different if it was conducted in a Western culture? And 2, in terms of another slide you presented, I think it's not just what you're choosing to measure and the results, but it's how you're interpreting the results in terms of your own personal bias into the results as for drawing conclusions. Thanks.
Yeah, thank you.
There's one comment up there. Oh. One.
Ways of knowing as it relates to health has always fascinated me. Thank you, B-Rat. I don't have a specific question, but really enjoyed you talking about both the researcher and the research participant growing together through a project. I have found that to be true in my research experience. So not really a question.
I have a quick question. Is this how this works?
Yes, Sarah, go ahead.
Okay, sweet. I'm also a nurse, B-Rad. I'm just curious, what aspirational visions you have involving this framework and this way of knowing for your work in Missoula in the coming years. Next steps.
Yeah, so I mean, this is a really personal question, so I answer it that way. But I am a nurse at the health department, and I like my job. My job really supports me. I get a lot of liberties to be a student and do my job, and I think that I'm in a great position because my schooling helps inform the work that I do. And one thing that I think that I hope to do with this in the future is now Missoula Public Health is and has been for a few years an academic health department. And that means that we have an agreement with the University of Montana School of Public and Community Health Sciences that we can collaborate on research projects. And I think that I'm kind of getting to the point where I think I can do better and better serve my community by engaging in research with the community and using this framework to help make sense out of what I learned from working with populations of interest than calling people all day and asking them where they got their chlamydia, which is also important work. But I think that we can really move further upstream, and research can be the compass to get us there to where we can really start to make a change in those numbers. And until I get to the point where I can, incorporate the research, which I'm starting, it's happening. But on a day-to-day, like what could I do today when I get home and get on the phone? Is just be aware that the person I'm talking to is a human with a consciousness, with a perspective. And what we're going to talk about is that they're sick because they have some kind of an infection. And we're going to make sense out of that. And we're going to help them evolve into a higher pattern of functioning in the world. And hopefully that means that they're going to follow the measures recommended to prevent spreading the infection. They're going to fully recover. And then they're going to go on and be higher evolved beings as they embrace their ontology.
Leanne, if you want to go ahead and unmute and ask your question.
Hi, VRAD. This is Leanne.
Hey, Dr. Pierce.
Hey. So first of all, great job. I truly appreciate that you took that initiative to make people think outside their comfortable box, as I would say, and really take a step back and look at different perspectives. But I am wondering, in your professional opinion, and as you're doing the research, why do you think this, like Newman's theory, is not used more in research?
That's a good question. And
Thank you.
I got to be careful how I answer that because I'm a student and I don't want to upset anyone. But I haven't noticed anywhere in my required coursework a class on theory. And so I don't think that it really gets a lot of attention. And I don't, I do want to give nods, like especially I took a qualitative research class and like the first day was all theory. A lot of theory was thrown out there, and eventually we had to move past that theory and get to doing. But I'm just not sure if it's something that's taught enough to be widespreadly used and applied.
Okay. Thank you. And just real quick, you mentioned that you're nervous about answering that because you're a student. Don't ever be nervous about answering. Your students are what keeps us on our toes. So thank you.
Thank you, Dr. Beers. I appreciate that.
Sure.
There's one more question in the chat, and I think for timing's sake, this might have to be our last one so we get students off to their next class. Rosemary Cree Medicine asks, was there a mandate or something when they stopped using BMIs? I always thought it wasn't good. It wasn't a good fit for Native Americans. Currently, our CHR program is still using BMI on clients they serve.
So this is a question that's a little out of my wheelhouse. I work infectious diseases. What I understand is that there was not a mandate. This was an internal decision made at Missoula Public Health, and it was a data-driven decision based on the qualitative data that this can cause harm. And I think that this is also an example of, Missoula Public Health being progressive and waving a flag in the face of people that just want to, stick with the traditional ways of doing things. I think that when you're gonna be innovative, sometimes you have to break away from the mold. And I want to give kudos to the health department for doing that. And I'm hopeful that in the agencies that you're mentioning, there will be an opportunity for people to advocate and have a similar outcome where you can say, hey, you know, this is not that great for data collection, plus it's causing some harm. Let's stop doing it. Let's find different ways to spend our time.
Thank you.
Yeah, thanks for the questions.
Okay. Thank you.